Hello and welcome everyone to our event. We are so pleased you can join us today to uncover what is disrupting healthcare in Southeast Asia. My name is Wenyi and I am a part of Johnson & Johnson Impact Ventures. At J&J Impact Ventures, we recognize that there are areas where government intervention and non-profit efforts are perhaps not enough, and private sector is required. So we work to connect entrepreneurs who marry health and impact with networks, patient capital, and expertise to meet such needs. If that sounds like you, do find out more about a second event we are collaborating with Tech in Asia on, an exciting pitch battle to hear the best ideas. With that, I'm going to hand you over to Nilesh, who is a part of J&J Innovation. He absolutely shares our excitement on the role of innovation in improving healthcare for everyone. Nilesh, please.
Thank you, Wenyi. And thank you so much for J&J Impact Ventures and Tech in Asia for organizing this webinar on such an interesting topic. Hello, everyone. My name is Nilesh Wadhwa. I work as the Director of New Ventures and Transactions at Johnson & Johnson Innovation, Asia Pacific Innovation Center. At Johnson & Johnson Innovation, our mission is to curate and cultivate world's most promising early-stage healthcare innovation wherever it originates. Through our global Johnson & Johnson Innovation Network, we provide regional points of entry for life science and health technology innovators to access the breadth and depth of offerings that are unique to J&J. By connecting the best science, technology, and entrepreneurs to our resources, tools, and expertise, we aim to expand and accelerate solutions that address the toughest healthcare challenges and improve the lives of patients and consumers around the world. Depending on where an idea is in its life cycle, our collaborators and partners can easily tap into our broad and unique range of collaboration models and capabilities. We leverage innovative business models and deploy a suite of capabilities with the goal to meet the diverse needs of entrepreneurs, scientists, and emerging companies from across the pharmaceutical, medical device, and consumer health sectors. We welcome you to visit our website or write to us if you have a breakthrough solution or an idea and would like to explore avenues of collaboration. Our session today is about disruption in the healthcare scene within Southeast Asia. Asia, as you know, is primed for rapid healthcare change driven by shifting demographics, rising expectations, and technological advances. Whilst there has been limited legacy health infrastructure, last 2 years have witnessed an acceleration in innovation within health tech, med tech, and digital technologies, and of course, healthcare management practices, as the industry has tried to adapt to the challenges posed due to pandemic and the needs of the hour. Today, in this session, we will be discussing some of the themes such as issues faced in 2021 and what this would mean for 2022 and beyond. What are the forecasting trends for healthcare in Southeast Asia? What do the investment opportunities look like due to the growing number of healthcare startups? And what might be the frameworks or matrix used to measure the impact of healthcare startups? Please note that at the end of the session, we have allocated some time to address your questions and answers, and we will try to address as many as the time allows after our panel discussion. I would like to invite to stage our esteemed panelists, Jervin Yang and Mei Lo. Jervin Yang is director at Open Space Ventures. He's an important leader in their investment team and is heavily involved with open space portfolio companies, specifically in Philippines. He has over 10 years of experience in investment management in both public and private markets, and was most recently part of Franklin Templeton Emerging Markets Equity Team, where he covered the technology sector. Prior to that, he worked in Deutsche Bank, Singapore. Jervin holds a BSc in economics with a major in finance from Singapore Management University. Our other panelist is Mei Lo, who is a director at ABC Impact Asia. Mei leads the execution of investment by ABC Impact across the region with a focus on healthcare. Since joining ABC Impact, Mei has been involved in deal origination, evaluation, and execution spanning multiple sectors, including healthcare, rural microfinance, and agriculture and food. Before joining ABC Impact, May was a vice president at Quadria Capital, a private equity fund focused on healthcare opportunities in Southeast Asia and South Asia markets. At Quadria, she saw opportunities across the region and worked on transactions spanning healthcare, diagnostics, devices, life sciences, and other allied sectors. Jervin and May, thanks for joining us today. It's such an interesting topic that we are going to discuss in this session. And I would like to, it will be very interesting to understand your views on how thoughts and issues on how you see the issues that have been faced by the healthcare industry over the last 2 years. Healthcare is a necessity, and need for quality and affordable healthcare continues to rise as we advance. What are some of the areas that you feel have improved or advanced according to you in the last 2 years? And what does it mean for the industry as we move forward? Areas like telemedicine, global digital health, funding, etc. So what are your views, Jervin? Maybe I can start with Jervin.
Yeah, thanks, Nilesh, for that really important question. I think there's two key things that happened over the course of the past few years while the world was dealing with the pandemic. Number one, the supply and demand dynamic of healthcare institutions and the weaknesses that was been brewing over the course of many years have surfaced up tremendously and in force. And the bright side to that is the acceptance and adoption of digital tools to augment the gap in supply and demand has been well accepted by many players and stakeholders in the industry. So that's something that we have seen in many of our portfolio companies and how they deal with their end customers across different geographies globally. And we do think that this trend will just continue as it progresses towards not just in helping augment supply in the healthcare space, but more so in controlling costs as well as we go into the future.
That's interesting. May, what is your view? When we talk about costs, do you think Asia is positioned well enough to manage costs and supply chain with the emerging companies in the region? ABC has done a lot of investments or is looking at a lot of investment in this area. So what's your perspective on this?
Yeah, I think absolutely there is a huge role for tech to play in terms of cost control and making the overall healthcare system more efficient. We've seen more mature models in other jurisdictions because, frankly, in Southeast Asia, I think digital health is really quite early stage. So you see a lot of like telemedicine or most people focusing more on the delivery space, but really there can be a lot more business models that we can explore, especially around, like you said, supply chain, logistics, making sure we see during the COVID pandemic how important it is to ensure supplies of essential consumables, your PPEs, your masks, etc. And I think we have seen interesting models that uses technology to ensure efficient supply and allocation of resources. And I also agree with Jervin that a lot of it has to also do with bridging the gap in demand and supply. And I think in Southeast Asia, a consistent problem we see is the unequal distribution of clinical talents. They tend to be concentrated in urban areas. And so I think that's a really big role for tech to play, because with the improved and adoption rate of technology and telemedicine, you can potentially increase access to healthcare in a lot of the more remote places in the region. Yeah.
You made an interesting point about the talent and the gap there. This is certainly a known fact, especially in our region where there is a significant underserved population and the ratio to the healthcare providers and population is very low. What, in your view, are some of the challenges in this area, and how do you think the technology or the tech companies can play a role in bridging this gap, because clearly by making digital technologies, telemedicine available, you're kind of getting more impact for the same talent, from the same talent.
Yeah, so I do agree with that. And I think to just give specific examples, if you look at every country in this region, I think apart from Singapore, the number of doctors, nurses per X number of population is far, below that of like developed countries. And so that's where I think you would need something to bridge that gap. But unfortunately, major hospitals, training opportunities where people prefer to live will be still mainly around urban centers. And I think that's where telemedicine or any kind of using technology to pool expertise is going to help in this area. And maybe when we talk about that, we always think of the direct delivery of healthcare, but there are other things that we can maybe think about, for instance, sharing of know-how, using technology to also support some of the care providers who are around the patient themselves, right? So that's that kind of support, I think, can also be delivered through a technology means. Yeah.
So you mean something like point of care diagnostics, outpatient care, etc.
Yep.
So, Jevin, maybe I turn over to you now. What are some of the areas you think we should focus on, or the industry should focus on from a standpoint of disruption? Because to meet the increasing demand of healthcare delivery, there needs to be disruption. So what, in your view, are the areas industry collectively can drive this disruption?
Yeah, that's a multi-faceted question, Nilesh, and I'm glad you asked that question. Yeah. So first off, right, let's ask the question on what is a key solution that is getting acceptance in developed markets that helps, at least get the doctor to patient ratio equalized in this part of the world. And like what May said, technology helps a lot in these types of problems. The main purpose of technology is really to, introduce efficiency, and most importantly, if we apply that in the healthcare space, what we're essentially trying to do here is to increase the number of patients that a doctor and a nurse can look after at a single point in time. Right. So in the U.S., the hospital at home revolution is in its way, and what's basically happening there is that if a nurse can look after maybe 30 patients in a traditional environment, infusing a remote patient monitoring technology that is smart enough, that is insights driven, and is coordinated with a guided pathway that is accepted by many physicians globally, we can actually increase the number of patients that a doctor can look after at a single point in time from 30 to maybe 150 or even 200 or 250, you see? So there is technology that is validated by numerous regulatory bodies globally. So the next question is, what prevents this from being rolled out in a massive scale to the different hospitals that we have right now in Southeast Asia? And I think the main answer to that question is really change management, right? Anything that deals with upgrading technologies and reintroducing a new way of dealing with patients will require change management. And this is not an overnight effort. This requires a lot of patience, a lot of retraining and understanding of how this technology can help the hospital systems. So I think, to your question as to how we get there, I think everybody just needs to embrace the challenge of change management and really understand how we can all be, helping out in dealing with that transition.
That's an interesting perspective, and certainly agree with you. I think change management is going to be an important driver. It's a mindset shift that needs to occur, not only amongst the healthcare providers, but even amongst the other stakeholders within the ecosystem payers, the insurance sector, because there are always challenges around who will support the costs involved and so on.
Yeah, it's amazing, Nilesh, because if we think about it, the remote patient monitoring technology has come a long way from where it was just a few years ago. And there's a lot of studies out there that has been published that really shows improved outcomes, lower costs, increased efficiencies, better patient outcomes as well. So the data is out there, and this is validated by numerous top tier research fellows globally. It's a matter of the industry just moving towards that model.
Interesting. And when we talk of, and maybe you can possibly share your views, when we talk of, healthcare delivery, different tools that might be made available for remote monitoring, for, outpatient access to healthcare. Where do you think the biggest disruption is happening currently, in your view? Because you come across a lot of companies who are probably pitching for you for investments, and you probably also scan the market, and you've looked at the investment. So where do you think the major disruption is happening in Asia? I know, companies like HelloDoc, where OpenSpace has made investments, Doctor Anywhere, and there are several companies which are trying to play a role in some part of the care pathway. But is it holistic? Where are the gaps still, and where? What message would you like to give to the audience who are interested in knowing where the gaps are and where they could possibly position themselves going forward?
Yeah, sure. I would actually like to twist that a little bit, because I actually feel that in terms of technology, even before COVID, we have a lot of these technology already available to everyone. It's just that I think the mindset of people have changed, and be it out of necessity, be it just because of time, people just adopt technology more and have a more open mind to the modes of delivery. I think that's actually a more important change that has happened. It's continuing to happen and needs to be continuing from now for technology to play the role that it can to help improve access to healthcare. And why do I say that? Because we looked at a lot of businesses, and from an investor perspective, I think two things are important. Of course, the technology itself has to be efficient, viable, and effective, but we also have to consider the business model, or the mode of delivery, whether it will be adopted. And that's quite important, because healthcare is unlike other sectors. I'm sure you all look at other sectors, e-commerce. Going to see a doctor, treating a disease is a very different decision-making process compared to, say, buying something like I buy TV from an e-commerce provider. So unfortunately, I think there always has to still be an offline or in-person part of that journey, and how to combine that effectively to leverage technology in a useful way, I think is the challenge. And a lot of times we see teams that are very focused on the technology, but less experience about the clinical operations. We also see very experienced clinical operators, but I think doctors, hospitals, traditionally, they don't really think about themselves as, they don't think about tech in the forefront, right? Everything is an aid to delivering care. So I think it's very important to have the right balance. And for a team, it's also important to have both focus. And it's something that I have to say is actually quite rare. And it's a difficult, it's a rare talent, I would say. And just to share that we actually invested in a home care service provider in India. last year. So I think it's a good example of using technology, but fundamentally it still remains something that has a traditional delivery model to it, because the patients will have to be referred from hospitals. That means they will have to come from doctors. Doctors will have to endorse this kind of service. I think it's very, that's why I'm a little bit, I think it's a little bit challenging for some of the direct to see kind of healthcare tech, because without that clinical backing there, it is hard to change people's mind, and people will not have that trust. Yep. So I think it's really the mode of delivery that really matters.
And certainly from what you say, I think the clinician still remains an important stakeholder within the whole delivery, healthcare delivery, and obviously the technology is our enablers, technology, data, everything else, artificial intelligence tools or point of care diagnostics, these are all enablers. And obviously the clinicians will have to embrace the fact that they can't reach out to so many patients directly one-on-one, and they now have tools in the form of these telemedicine, remote monitoring technologies, which can help them enhance the patient outcomes. So in terms of, the healthcare startup space, there's a lot of them emerging, budding healthcare startups in Asia. Where do you see the most investment potential? And what do you look for as an investor? Because both of you represent two different, VCs and with a different approach. So it'd be interesting to hear each of your views. So maybe, Jervin, you can go first, and then May can share her views.
Sure, yeah. So in open space ventures, our thesis mainly relies on two things, right? Number one is lifetime value, and at the same time, technology as a tool to scale up the business model, right? So in that sense, the way we invest in health tech is that we love companies that want to tackle chronic conditions that have a very high prevalence rate, and they have a differentiated technology angle that would really help hospital systems to scale up their program in terms of dealing with that chronic condition. And the reason why we think about it this way is that the reality is, like what May said, pathways that has been established many years ago and have produced really good outcomes for patients. That's just really hard to change up overnight, right? Yeah. It's practically impossible to do that. And that's why when we think about technology, what we're actually looking for are smart people out there who manage to digitize these established pathway and enabling hospital systems to scale up the way they deal with the volume of patients that they need to treat in a year. So in that sense, you've got a business model that is very sticky, very well accepted as well by the stakeholders, but more importantly, produces the same or even better outcomes for the patients. Yeah.
Interesting. May, what's your view?
I do agree that scalability is a very important aspect for us, especially because our mandate is creating positive social impact through our investment. So I think being able to reach large populations within our investment timeframe is very important. And so there are a few themes that we have identified that we like, right? So we actually like B2B kind of models because that actually helps to enhance efficiency of the system, the delivery system, and will benefit everyone in the system. Some of the 2C technology or products, I think they are, I'm not saying that they're not impactful, but like more often than not, they will start being higher price items, and it will probably in more well-off countries. And so because of our mandate, we tend to look at that, less, and we look at, the B2B or the scalable options more. I think when we think about scalability, it's also important that when we're looking at Southeast Asia, it can be scaled across the region relatively easily, because the countries within the region are actually quite different. So again, it boils down to the business model. If it requires a lot of customization for each jurisdiction, then we do feel that execution will be a bit more challenging and will require more time. Whereas if you have something that's pretty, you can just replicate easily across countries, and it's something that's very suitable for, our kind of mandate. Yeah.
That's a nice view. I think you're right. I mean, the region is very diverse. I think the needs are very diverse. The ecosystems within each of the countries are very diverse. So at some level, if there's harmonization, at least in the way they embrace technologies, I think that would be really an helpful enabler to roll out these technologies in the countries. But having said that, and you mentioned that your preferred model is B2B, which is understandable when you're talking of classical chronic disease management, and patient monitoring. What is your view on preventive health? Because last 2 years have also created a lot of awareness amongst patients, consumers, people generally at general population about health, wellness, and self-monitoring rather than depending on a healthcare provider to support all the time. So what's your view in that space, because the wellness space, because again, there are several companies, startups which are emerging and providing these solutions, which are, fitness trackers and, devices, tracking devices, etc. What's your view on that? And do you see there's an interplay between the two ends of the spectrum?
Sharon, do you want to
Sure.
say something? Yeah.
Yeah. So you're right, Nilesh. They have a space in the whole healthcare continuum, right? Preventive health is a very important part of not just from a regulatory perspective, but also from owning to one's own health kind of way. And the wellness space is a massive industry out there right now, and I think that if we count the number of apps that are regulated by the FDA versus wellness apps that are available in the market right now, readily available for download, we're looking at I think the statistics was 100x differential. So meaning for every one regulated app that is available in the market, there's 100 more that is available there. So you can see that it is a competitive space if you are dealing on the wellness side. Having said that, it all boils down to how differentiated you are in the sea of different offerings in the market, right? What I tend to believe is that if your solution is more holistic in such a way that it involves the different players in your overall well-being, meaning you've got your caregivers, you've got your family, you've got your maybe a line to a doctor or a physician, that is something that is can produce way better outcomes than your typical just tracking your heart rate or tracking how many steps you're doing in a day, obviously, right? So something that is more holistic in nature as an offering, if you're in the wellness side of things, I do believe that there is a place for that in the overall ecosystem.
Well said. I think, Jervin, you're so right. I think that is going to be the way forward. Integration of all the technologies, bringing in all the players to improve your own health outcomes.
Yes. Yeah.
May, any views on this?
I just want to build on the point about having a more holistic approach. I do think that there is a lot of room for wellness, preventive healthcare. We see a lot of apps. We see a lot of like wearable devices in this space. I think what's important is that it will feed into the whole care cycle so that people can make use of it, not just, if you just have, like you said, oh, I get my heart rate or whatever. It's not as helpful as, how do you then use that data to customize for yourself a health plan that would work for you. And I think there's a lot more that technology can play, right? You're talking about personalized health data. You're talking about, I think insurance companies will actually be very active in this space, and given the amount of data that can be tracked. But then for us, we also sometimes wonder, if we look at business like that, we also consider the positive potential risk, which is the misuse of the data, mis-selling of services. It's a big one for us, because and patients are a vulnerable crowd, right? And then we want to make sure that there is a balance between generating useful data versus being engaged in very like predatory kind of behavior. Yeah.
Thanks. I think that's very helpful, and obviously from a healthcare or from an individual perspective, I think it's important to see these tools as enablers and not get hooked onto one because you see it as an enabler. I think it requires a lot of lifestyle change, mindset change, and making sure that you are closely connected with the healthcare providers that are trying to manage and help you manage your health. So very interesting insight. I think that's been an interesting discussion. I think we can go on for much longer, but I think we start getting questions also from the audience. So let's try to address some of the questions. The first question is for you, Jervin, from Jake Lee. This question is, how do you want healthcare to make it sticky when the purpose of doctors and healthcare providers is to heal people and make sure they don't come back too fast or too often?
Thanks, Jake, for that question. I think there are two ways to answer this question, right? The first one is dealing with chronic conditions. The fact of the matter is there's some diseases out there that can't be treated. It's a condition that a person will have to deal with for the rest of his or her life. But the key then is to how do we make sure that the symptoms of that disease is controlled in such a way that the individual can continue on with daily life uninterrupted, right? And that involves a lot of lifestyle changes, right? So it's not that we are trying to make the patient sticky to keep on coming back to the doctor, as you pointed out, but make sure that they follow what the doctor has recommended in terms of what therapies they should be taking, what change in lifestyle they should be doing, and more importantly, how they should be able to assess their own health along the way. And this can be done with biosensors or maybe patient inputs in an app which the doctor can easily see, right? Now, another way of looking at this question then is, what about people who just went into an acute event, meaning they had a heart attack, let's say, or they had something where an operation was needed. Statistics out there has been very, very clear, right? Majority of these acute events that happen because patients do not follow the directive of the doctor after they have been discharged in the hospital. It's highly likely that in 2 to 3 months, they're back in the hospital bed. And that costs a lot of money, not just for the payer, but for the hospital system as well, right? So,
no, I just want to add that, sometimes it's just not one of acute conditions that would need healthcare provision, right? There's also like a lot of chronic, I think you mentioned like chronic disease, things like diabetes. If someone has a stroke, they would need like lifelong management. Diabetes need lifelong management. So something that can be addressed, and it's a long-term thing.
Yeah. So when we say sticky, right, we're actually talking about compliance, right? We want to make sure that the patients are very compliant to the guideline medications that has been established for many, many decades already, which has been proven to produce really good patient outcomes. That's essentially what we want to happen with the use of technology.
Great. Thanks so much, Irwin. I think that was very aptly addressed. And there's one more question. I don't think we have much time, but we have one more question, and that maybe May, you can take that question.
Yeah, sure. I actually am ready to answer that. I do observe, I think the question is, are you aware of any difference in user behavior when using healthcare between different countries in Southeast Asia? Definitely. If you go to, say, Indonesia or Vietnam, you'll see that people don't go to, there are no concepts of primary clinics, right? People go to the hospitals for their flu, for a stomach ache. And so I think that's another area. Actually, that's another area that's really interesting, but unfortunately, I think it's still very early, and which is primary healthcare in Southeast Asia, because what the issue is that everyone goes to the hospital for everything, and it really overburdens the public healthcare system or the hospital system. And that's something that we really need a solution. And because of that kind of differences, you can also, like, I've looked at telemedicine players, right? So you can't replicate the model here in Singapore where people go to GPs and replicate it directly to a place like Vietnam or Indonesia, because people don't go to GPs. There, maybe their first line of healthcare will be their local pharmacy, and maybe that's the equivalent. So that's just an example. There are other differences, and you will know when you operate in these jurisdictions. Yeah.
Thanks, May. May, I have a question actually, and I'm sure many of the audiences would want to hear your views. So how do you frame impact in companies you invest in? And you addressed some of those already earlier. And what are the common metrics you look for? I mean, just on a very high level, I know each investing entity would have its own matrix, but just on a very high level so that our audience know what to prepare for.
Yeah, you're right that every investor has their own impact mandate. We define ours against the UN SDGs, and there is a very broad SDG 3 about universal healthcare coverage. Those are actually very broad country level targets. And so what we have done is to also look at some of the systemic improvements. So how does a business or a service contributes to improvement of the healthcare system? It can be direct on the patient, it can be on the population level. So for instance, reducing the rate of diabetes, reducing the rate of a certain chronic disease or condition. It can be in terms of making the system more efficient in supply chains, logistics, or equipment or technology. So what we do is really to identify the specific contribution that a business or service or product would generate.
Yeah, I echo May here. At Open Space Ventures, we do it on a case-by-case basis as well. So for example, for HelloDoc, we actually measure how many teleconsults happen outside of Java, let's say. And then for Bioformis, which is one of our investments as well, we measure how many % of patients did we reduce readmissions. So it's basically something that is very attuned to what the company has set out for as their goals.
Yeah, just to add that, of course, like number of patients are very common, like things that we measure, but we also try to measure things like the number of doctors, number of technicians, number of nurses that are trained, especially if we invest in like a medical institution. I think that's a systemic benefit that's also very important for the region.
And May, I think that's very insightful, May and German, and quite interesting. I think there are different perspectives. And the questions keep coming. I think I'm sure the audience is very excited and they've really enjoyed the interaction. So we might be having time to take a couple of questions. I know it will extend our time of the session, but happy to flash those. So maybe we can take, okay, what are the factors? So this is a question from V. Swanarath. what are the factors that contribute to the reluctance of healthcare industries or patients in general to adopting technology in healthcare? And very briefly, I think you've touched upon some of these aspects in the conversation. So I think you may want to look at the video again, the session. I think some of these questions were already answered. I would probably jump on to the next question, which is from Valdianti. There are several initiatives to develop telehealth for communities in remote areas within Southeast Asia. What do you think are the challenges providing this service?
I think like the availability of clinical talent is one, because you would probably not find doctors in some of the more remote areas. And I think your chances of finding specialists is even less. And also, I think then also just people don't have a concept of wellness or preventive healthcare. So oftentimes they only go to doctors when something really, really bad happens, and that would oftentimes be too late, and it also creates burden on the system.
Interesting. And maybe there's time for one more question, and that was from Alberto. What is the best way to manage different laws in this extremely regulated sector? It's a bit sensitive because this is beyond probably our realm, but it'll be helpful to hear your views, German and May.
Yeah. I mean, he did mention it, right? Like, aiming for the most restrictive regulator. No, but the reality is, I think this is assuming that you have validated your solution, right? I think the most important thing to do first is validate your product. Make sure that you are hitting your endpoints, primary and secondary endpoints, really, really well. And then after that, think about FDA or the EU regulatory body, or an HSA, and then things will, as long as you have a validated product and then you're confident of the safety.
I think
yeah,
that's right, Joe. And I think that's one of the critical factors when you're trying to bring in these technologies, which are going to be self-use technologies, with limited supervision by the healthcare provider. I think ensuring that your application or your technology is high on safety and has all the validation which is required to comply with the regulatory requirements. And I think, of course, I'm not a regulatory expert, but I see that the regulators have obviously been looking at this very carefully, and they do realize a need to create strong regulatory frameworks to manage this within Asia as well. So a lot of learnings from the US and European regulators, and HSA, of course, is taking the lead here within Asia.
No, the FDA has come up with the software as a medical device designation, right? And then it speeds up the regulatory pathway for many of these technology-led type of therapeutics. So there are pathways to get there, but you really just need to focus on validation at the beginning.
Yeah, it all depends on where your market is going to be, of course, and using US FDA or European guidelines as a starting point, and developing your technology solution in line with that would really put you in a good place. And that would be
absolutely
right. Yeah. Great. I think we've had a very interesting session. Thank you, Jervin, May, for your time today. I think it was very engaging. I think the audience I'm sure they have a lot more questions, and those are probably coming into our Q&A box. But unfortunately, we don't have more time to go into those, but certainly look forward to the next session where we can try and address some of the other questions and hopefully address another interesting topic relevant to our region and the healthcare system here.
Thanks for having us.
So thank you very much, audience, for staying with us for the extended period as well, and in the first place, joining our session. I'm sure you would have found it very interesting. We had really highly involved and engaged panelists in Jervin and May who know the landscape pretty well. Thank you once again on behalf of the organizers as well. And flashed on the screen, you will see the contact details for J&J Innovation. As I mentioned, we remain open to hear from you, your breakthrough solutions, about your breakthrough solutions and ideas. Feel free to reach out to us as per the contact details provided on the screen, and we'll be happy to explore avenues of collaboration. Thank you so much once again, and over to Wenyi.
Thank you, Nilesh, and thank you, May, Jervin. Thank you all for the very engaging session. We hope that you'll get in touch if you think J&J Innovation, as Nilesh has mentioned, or J&J Impact Ventures might be a fit for you. With that, we thank you for your time. If you do have questions, please do get in touch, and we wish you a great week ahead.